Hello, my name is Kathy, and today I'll be discussing how to use homeopathic remedies on ailments, continuing with heart, blood, and circulatory ailments, starting with the letter A, Part 3. But before I do this, I wanted to let you know that because I have a great many videos now on many different topics, that I've decided to make several different video playlists so that it's easier to find the videos of greatest interest. So please check out my playlist page. Please refer to my How to Use Homeopathic Remedies video before using the material in this video. I'll be discussing how to use homeopathic remedies on specific ailments, but I've broken these ailments into categories for easier reference. I'll begin with ailments of the mind and emotions, then I'll move on to ailments of the brain and nervous system. Then I'll address issues with your skin, nails, hair, eyes, ears, nose, teeth, gums, lungs, respiration, heart, blood, circulation, muscles, bones, joints, esophagus, stomach, duodenum, small and large intestines, liver, gallbladder, pancreas, kidney, bladder, then ailments specific to women and specific to men, then issues of the hormones and metabolism, and after that I'll address the issues of homeopathic remedies on infections, infestations, and the immune system, then issues surrounding fertility and pregnancy and surrounding childbirth and postnatal problems, then homeopathic remedies that address special problems in infants, ailments and diseases of childhood, and special issues of adolescence, and finally, special issues of the elderly. Constitutional treatment involves treating the totality of the individual person. Everyone is a unique individual with a unique physiology that responds to substances differently. In homeopathy, it is recognized that people will react strongly to certain remedies, and as a result of this, they can be loosely placed into different categories called constitutional types. Homeopaths talk of, for example, phosphoric types. These are people who react strongly to phosphorus, or arsenicum album types, those who react strongly to arsenicum album. The belief is that people of one type share similarities in terms of body shape, character, and personality, and the sorts of diseases from which they suffer. As an example, nature-mirror people tend to be pear-shaped, have a dark complexion, be fastidious and rigid in personality, and keep themselves to themselves. And they also crave salt and suffer from constipation. As another example, lycopodium types tend to be tall, gangly, of stooped appearance, with an anxious expression and a craving for sweets, and a propensity to produce intestinal gas. Now, of course, constitutional types have their limitations. In reality, each person is an individual, and so there are as many constitutional types as there are human beings, and an account must be taken of the sum total of the person's inherent predispositions, past illnesses, diet, general reaction to the environment, intellectual and emotional features, and general attitude towards life. This is what is meant by constitutional treatment. I'll be making detailed videos of various constitutional types after I've completed the use of homeopathic remedies on ailments. The ideas, procedures, and suggestions in this video and all my homeopathic videos are not intended as a substitute for the medical advice of a trained health professional. Consult your physician before adopting the suggestions in this video. If you're pregnant, do not attempt these techniques without the approval of your physician. So, let's continue learning how homeopathic treatments can help with heart, blood, and circulatory ailments, continuing with the letter A, third part. The heart is really two pumps, each composed of an upper and lower chamber and two valves, one between the upper and lower chamber and one at the exit from the lower chamber. The right side of the heart is the less muscular of the two pumps. It receives oxygen-depleted blood from the venous system and sends it to the lungs for oxygenation. The other half, the left side, receives oxygen-rich blood from the lungs and sends it shooting up through the aorta and around the whole body. Branching off the aorta are arteries and arterioles. Their walls are muscular and elastic and are designed to transmit the pumping force of the heart to the farthest reaches of the body. Blood is collected from every part of the body by venules and veins, which are thin-walled and have valves in them so that the blood can flow only one way, back to the heart. The pumping action of muscles helps to push blood through them. Connecting the smaller tributaries of the arterial and venous system are the capillaries. These are blood vessels so small that in major organs and muscles there are thousands of them per square inch. Oxygen-carrying rich blood cells are pushed through them by the pulsing pressure of the heart. Blood pressure depends on three things: the tone of the artery walls, the pumping force of the heart, and the volume of blood in circulation. Generally speaking, blood pressure creeps up with age. This is because the kidneys become slightly less efficient at regulating the water content of the blood, and because arteries tend to become less elastic, thus forcing the heart to work harder. Blood is the body's universal transport system. It carries everything the body needs: oxygen, sugars, fats, proteins, hormones, minerals, and clotting factors, antibodies, as well as everything it does not need: carbon dioxide, other dissolved gases, urea, hostile microorganisms, and their toxins, as well as general debris. A grown man has about 5 liters of blood in him, about 8% of his body weight. Plasma, a straw-colored fluid that is mostly water, accounts for 55% of blood volume. Red and white blood cells and platelets make up the rest. Red cells carrying oxygen bound to an iron-containing pigment called hemoglobin, and the platelets prevent blood loss by initiating the clotting process. Far outnumber white blood cells, though during infection the latter multiply enormously. White blood cells are part of the immune system protecting the body against disease organisms. At the end of their useful life, which is seldom longer than 3 months, even in the healthy of us, red and white blood cells are destroyed and recycled by the liver and spleen. Destruction must, of course, keep pace with creation in a healthy individual. The bone marrow produces as many red blood cells as the spleen and liver destroy. The lymph glands, the glands that swell up during infection because they are busy producing a variety of white blood cells, are part of the secondary transport network, the lymphatic system. The spleen, tonsils, bone marrow, and thymus are also part of the lymphatic system, whose vessels run in every part of the body. Lymph vessels have much thinner walls than veins, but like veins, they have one-way valves in them and depend on the pumping action of muscles for their circulation. These transport lymphocytes to sites of injury and infection, collect emulsified fats from the small intestines, and drain fluid from the space between cells. This fluid contains proteins and other valuable substances that cannot be actively absorbed by the blood vessels. The contents of the lymphatic network eventually empty into the bloodstream through 2 ducts, one on either side of the neck at the junction of the subclavian and internal jugular veins. Arrhythmias. Arrhythmias are irregular heart rhythms that develop when a special group of cells called the sinus node in the right atrium of the heart does not function properly. These cells distribute electrical signals to other electrical relay points in the heart, causing 4 chambers of the heart to contract in correct sequence. A malfunction of the sinus node can occur if the brain overrides the heart's own pacemaking mechanism, or if the heart is damaged by coronary artery disease or rheumatic fever, for example. It can also occur in unfit people taking unaccustomed strenuous exercise. Ventricular fibrillation is an uncoordinated switching of muscle fibers in the ventricles, which can cause cardiac arrest. If the person suddenly stops and inexplicably loses consciousness and stops breathing and has no pulse, call 911 and commence cardiac resuscitation. Heart block is the beating of ventricles uncoordinated with the beating of the atria. This may be mild or severe. 3rd-degree heart block causes sudden loss of consciousness, often with fits. The appropriate action is to call 911. Arterial fibrillation. This is when the atria of the heart beat much faster than the ventricles and may produce symptoms such as breathlessness, dizziness, heart palpitation, fainting, and chest pain similar to angina, but is not instantly life-threatening. It may lead to heart failure or to an atrial embolism. So the appropriate action is to see a doctor within 2 hours. Paroxysmal tachycardia is a sudden doubling of the heart rate, lasting minutes or even days, that causes a pounding feeling in the chest, breathlessness, and sometimes chest pain and fainting. This condition slightly increases the risk of congestive heart failure, but is not usually serious. However, symptoms should be reported to your doctor. Ectopic heartbeats. This is when the heart occasionally misses a beat or gains an extra beat. It may be alarming, but this is usually nothing to worry about. Caffeine, nicotine, or alcohol may be the culprits. Constitutional homeopathic treatment is recommended when anxiety is a major factor. Specific remedies to be taken every 2 minutes for up to 10 doses when heart palpitations come on, provided there is no fainting or loss of consciousness. If there is no improvement within 30 minutes, call a doctor. For difficulty breathing that is relieved by lying on the right side with the head well raised, and there is a shuddering of the whole body and the person cannot bear to be touched, use Spigelia 6C. For anginal pain and violent heart palpitations that are made worse by lying on the left side, and the person has arterial sclerosis, use Cactus 6C. For sensations of blood surging up into the head, with the pulse irregular but forceful, and there is angina pain and a fear of dying, use Naja 6C. When the whole body is pulsating with angina pain extending into the right arm and a warm room makes the symptoms worse, use Lilium 6C. When the pulse is loud but irregular, with heart palpitations and a feeling of heaviness and pressure in the heart region, with occasional sharp, stinging pains passing from front to back, and the symptoms are made worse by laughing, coughing, or the slightest exertion, use Iberis 6C. Self-help. Avoid tea, coffee, alcohol, and smoking, all of which interfere with heart rhythm. If you suffer from high anxiety levels, learn some form of meditation, contemplation, or relaxation. Moderate daily exercise can also help to disperse anxiety. I have a great many videos now on many different topics, so I've decided to make several different video playlists so that it's easier to find the videos of greatest interest. So please check out my playlist page. Well, that's it for now. To stay up to date with my latest videos, make sure to subscribe to this free YouTube channel by clicking the red subscribe button right below this video. Take care.